Hello, everyone. Welcome to Conversations with Sekani, a podcast for people in their 20s who are trying to figure out life and not get lost along the way. My next guest right now, my guest now, is an osteopathic functional medicine physician, right? Helping women get to the root cause of painful periods and hormone imbalance, Dr. Jeffrey Brown. He focuses on hormones, inflammation, gut health, and lifestyle, not just symptom management, so women can experience calmer, more manageable cycles. So yeah, Dr. Brown, welcome to Conversations with Sekani. It's a pleasure to have you here.
Oh, thank you. Thank you for having me on the show. I love what you're doing, trying to impact lives, and that's why I'm here. This is spread the message.
All right, thank you. Okay, so first, before I go to my question, did I pronounce the osteopathic properly?
Yes, you did. It's very good.
Okay.
And that was a tongue twister.
All right. So yeah, um, you know, we're talking women's health, which is sometimes often overlooked, right? So you were a board certified family physician, and what made you step away from, conventional medicine?
Yeah, I stepped away from it very quickly after graduating from residency. I worked at a urgent care family medicine center, and I felt like I was just providing band-aids. It's just refill after refill after refill with patients, referring to, different specialists. But I didn't really see anybody really getting better. I didn't really see people really improved. Now, the acute care aspect of it, yes, you would do a good job when it comes to the acute care. But as far as the chronic care, there was a huge disconnect. And that kind of bothered me. One of the reasons why I went into osteopathic school was I wanted to learn the manual therapy. Osteopaths, we have the ability, or at least we're taught how to use our hands, similar to chiropractic. Chiropractic came from osteopathy. And so we have those skill set, although most of us don't use it. I did because I want to have more tools in the belt. And so I knew there had to be more than to medicine than just, writing scripts and surgery. And so I just went down a deep rabbit hole and, after a few years, found functional medicine. And once I found it, there was no turning back because then you can truly get to the roots. You're spending time with patients. It's a more holistic approach. So that's why I ended up, really stopping family medicine and just focus on the functional medicine.
All right. So, why do you believe women's health is, oversimplified in traditional care?
So I would say I know. I think every woman out there would agree with me on that statement. I don't think you could find one that would say it's a priority, in the medical society, right? How many options do you have, especially when it comes to PMS, painful periods, but antidepressants, birth control, pain medication, surgery. I mean, there's other ways of addressing that. But unfortunately, that's it. And that's why there's millions of women around the world that are suffering every month. Whether it's fatigue, mood, bleeding all the time, debilitating pain. That's why I say that. It's if we can do better than that. We definitely can do better than that. And if you spend the time really searching, like I have, others like me, we know that there are ways to, help to calm the body down, have regular cycles without the pain, without the drama, with all the stuff that can go along with it for those, unfortunately, who suffer with bad PMS and painful periods. So that's why I say that because they haven't spent enough time, with research, and there's really no other drugs out there to help them. It has to be a holistic approach. And in this country, as well as other countries, big pharma, the drugs, they take, center stage. They're the ones that dictate, how things are done. And so if it doesn't fit that model, which most diseases, chronic diseases don't, it's never just one medication, for one disease and then you're done with it. It's never that simple. Although people think it is, but it's like, no, no, it's never that simple. Our body is complex. And so it's never going to be a one drug for this one, disease or condition. It's just not that way, even though I think people have been conditioned in that way, but it's not that way.
Okay, well, may I say, I've been waiting for this opportunity to talk to you because I need to ask. Like, I've been waiting because this whole painful period thing. At first, I thought it was normal, right, to have
Mhm.
painful periods. But then I noticed some months it's not painful, then some months it is really painful. So can you explain why that happens?
Well, I mean, that's a good question. And I would say I recommend that women actually track their cycles. Look at, your activity level, what you've been doing. Look at the foods that you've been consuming because the foods play a big role, into that as far as especially the eating pro-inflammatory foods. Foods that we know we shouldn't be eating, but even the foods that you think may be healthy, they may be inflammatory for you. And that's
Mm,
why, I talk about doing food elimination diets. And I try to identify those foods which could be causing allergies or sensitivities, to each individual. And so if you track those things, I think you may find why certain months are better for you and other months, not so much because it's an inflammatory condition and that inflammation is coming from somewhere. And usually it's, the foods, the stress, how much stress have you had in your life? Because everybody has stress. And maybe certain months there's more stress in your life than in others. Maybe
mm,
there's more months where you are doing more self-care, where you are actually spending time in meditation and prayer, spending more time with friends, laughing, enjoying yourself. And maybe other months it's just, you're just focused on, surviving, which a lot of women do. And so that's why you're going to see those variations. And thank God you are having some good months. So now it's just a matter of figuring out, okay, what was I doing that month or what wasn't
mm.
happening so I can have more of those good months.
Okay, wow. All right. So yeah, can you tell us like how do hormones, inflammation, and gut health, how do they connect?
Wow. Yes. Well, hormones, gut, how do they connect? Yeah, it's kind of a circle. So the gut, 70% of our immune system lies in the gut. And stress, unfortunately, all of us have stress. And one of the things that stress does, it impacts the immune system. It brings that down. And so if that's the case, then we have this immune dysregulation that's going on, in our gut. And the gut is responsible for metabolizing hormones, specifically estrogen. And there's a community called the estrobolome that impacts the amount of estrogen that's being excreted and reabsorbed in the body. And so if we are eating foods that are inflammatory, if we're eating or toxins, especially, because a lot of places are using pesticides and
Mm,
herbicides and injecting hormones into the food. So our body has to process, all those things. And that impacts our gut health. And so that can influence how our gut bacteria behave. And so, like I said before, that estrobolome is responsible for that. And they secrete an enzyme called the beta glucuronidase. And that beta glucuronidase, if it's elevated, it can increase the amount of estrogen that is recirculated back into our body. So instead of getting rid of it, your body is reabsorbing. And then that will lead into the estrogen dominance factor. And so we really need to focus on eliminating those foods that contain the hormones. We need to try to cut down the amount of exposure that we have to the toxins and pesticides, with our foods. If you can afford to buy organic, definitely try to do that. Or at least, wash your foods very well or spray them with their herbal products that can help to eliminate and wash off those things better. And so there's that vicious cycle. And so again, with the stress, that affects your progesterone. It's like a seesaw. So when you have higher stress, then that puts your progesterone at a lower level. And again, that hormone imbalance with estrogen and progesterone. And whenever you have the estrogen dominance, well, that leads to the fibroids, that leads to the endometriosis, that leads to the PMS, that leads to the painful periods, all those things, ovarian cysts, all those imbalances of estrogen progesterone leads to those conditions that women are going to feel horrible with. And so that's why eating healthy, doing what we can to feed that gut bacteria so our gut bacteria is healthy, that estrobolome, that community of bacteria, it is
Mm,
healthy, so you can metabolize your estrogen in a safer way.
mm,
Managing our stress is so important, because again, that affects your progesterone levels. So spend more time in laughter and prayer and meditation and, time with your pets, loved ones, whatever that is to make you, feel good. I recommend people do that 3 times a day, at least minimum, to
mm,
spend time in we call rest and digest. Just got to keep that stress down. That keep that cortisol down. It's so important because, like you said, that connection between our gut and
mm,
stress and immune system, it's
mm.
all related. It's all linked.
Okay, well, all right. So, basically, if I am able to control my intake of some certain kind of foods, right,
Hmm.
I could, make life a lot easier for myself. Okay, I took that one actually. So yeah, many women they are told that their only options are, birth control, antidepressant, or surgery. Why is it that that's the default?
Well, as I said earlier,
Mm,
drug companies, that's what they provide, right? And so if they can't write a script for it, which means the birth control, the antidepressants, and the pain medication, then the really only option, your last option, of course, is surgery, whether it's laparoscopic removal of endometrial tissue or scraping of this or God forbid, hysterectomy, which is the last option. There's really no other option in the conventional medical space. They're not in the conventional medical space, there is no holistic care. Especially in our country, it's just, 10-minute visits, in and out, what's your
mm,
concern? They don't have time to dig into your past to figure out, where this could have started, what's the root cause of this. They just need okay, what are your symptoms and what drug can go along to address your symptoms, and that's it. But
mm,
unfortunately, with chronic conditions, that's not going to solve the problem.
mm,
You
mm,
may get a little bit of relief, if
mm,
that, but especially with hormones, that affects your mood, that affects your sleep, that affects your sex drive, your enjoyment of sex, your desire to have sex,
mm,
your energy to do things, your motivation to do things. It's not just about your pain, right? It's your
mm,
whole being, it's your whole
mm,
existence. And so, yeah, maybe you took care of the pain a little bit, or maybe you stopped your period with a birth control, but all the other things I mentioned, it's not going to be touched. And so you're still suffering from all the other things that the birth control or pain medication, didn't address because it's not getting to the root cause.
okay, wow. All right. Okay, so I was going to ask, right, why do you think, sex drive is higher among some women than the other? Do you think this also has to do with intake of food or is just a natural phenomenon?
That's a good question.
Mhm.
Because there's a number of factors that play into that.
Okay.
So one, I know that stress impacts your libido, your desire to have
Okay.
sex. And so I know women who have a lot of stress and maybe they grew up in a very stressful environment, had a stressful childhood, traumatic childhood, they're most likely going to have a lower libido
Mhm.
because stress, affects and impacts, your libido. Um, then you also have your hormonal levels. So if you have optimal levels of estrogen, progesterone, and testosterone, most likely you are going to have a healthier sex drive because your hormones are optimized. Now, if any of those levels are low or out of balance, then most likely you are not going to have that. So I know that birth control lowers testosterone. And so testosterone is an important hormone for having a healthy sex drive, a higher libido. So if you were on birth control for a while, that has
Mhm.
a higher chance of lowering your libido, because testosterone, is lowered. So it really depends upon, I would say, this the stress level.
Mhm.
Have you been on birth control? And if so, like how long were you on, birth control for? Did you have a diet that's inflammatory, where you're eating a lot of inflammatory foods, because that can impact your hormone levels. And so, there's multiple reasons for that, but those are my
Mhm.
reasons that I would say I think that, some
Mhm.
people have a higher sex drive, than others.
Right. Wow. So that means stress is actually a very major determinant factor to, women's health, right? Wow.
Yes.
So we actually need to tackle this whole stress thing. Okay. So yeah, I want us to talk about, healing holistically, right? So what does functional or, regenerative medicine look like in practice?
Okay, so yeah, good question. So when we're looking at functional medicine, our questionnaire is very detailed because we want
Okay.
to go back. We want to know, were you a C-section baby or were you a vaginal birth baby? Because we know how that can impact your immune system. Based on, if you travel down, mom's canal, were you exposed to all this bacteria and boosting up the immune system? Were you breastfed or were you bottle fed? Because again, that impacts your immune system. Were you sick a lot as a kid? Were you on a lot of antibiotics? Because we know that impacts your gut health. And so looking at your environment, what kind of foods you eat or don't eat, is your environment stressful? Is it peaks? All those things, all these questions that we ask, identify, okay, what could be the root cause or things that are influenced the condition that you are now. So we spend a lot of time, looking at your past as well as, the present conditions to try to figure out this narrative, because there is a narrative, there is a story that led us to, where you are now. So we spend time unpacking that so we can learn more, about you. And then we also look at labs differently. One is, we order, specialty labs that go a little bit deeper than just your standard blood tests. It could be urine testing, it could be saliva testing, it could be stool testing that gives it a deeper look, into that system. And then as far as blood work goes, we're really looking at, look at the inflammation markers. That's not typically run by, your primary doctors. And we also look at the ranges differently. So that's why oftentimes, I've seen a lot of women that, have seen physicians and they've been told that their labs are normal, but they feel horrible. So they know they're not normal, but the labs are saying they're normal. And that's because the lab range is basically, they're looking at diseases. And so we know that you don't have a disease, you're not sick, but your body is trying to do something. And so we know that within those reference ranges, we're looking for specific ranges that tell us that, yes, you are in the optimal range, not just in this wide range that everybody that so-called healthy, I don't even want to use the word healthy, but asymptomatic, fit into. So we look at those ranges specifically, and then we order a lot more tests that's not done by traditional medicine to give us a bigger picture of is what your body is trying to do, because your body is a beautiful thing. God created us so the body has the ability to heal itself. We just have to sometimes help it along. And so once we can figure out what's missing, where the imbalance is, what's created some inflammation, once we identify those things, then we can help assist the body to heal itself.
Wow. Okay, yeah. You mentioned foods, right? So what kind of food would you advise, people to eat, women specifically, and especially from childhood to, adulthood? What kind of food is advisable for us?
So that's a good question. I hate to focus on the negative. You want to say the positive. So I want to
Mm.
say focus on eating whole foods. So I'm not going to say what not to eat, 'cause I think you can infer what I mean by saying whole foods,
Okay.
foods that came from the earth. So if it's flying, if it's swimming, if it's crawling, if it came from the earth, those are the foods that we should be consuming. Stay away from things that were not grown. If you know they were made, if they were made by man, then I would not advise consuming that. No, so everything should be natural based, because then most likely it's going to be anti-inflammatory. It's going to be high in nutrients, and that's the thing. Too many people eat foods that are low in nutrients, and if that's the case, all you're doing is putting weight on and it's creating stress, to the body. So focus on whole foods, and ideally foods that were not injected with anything and sprayed, with things. And so if we can avoid those things and just focus on the healthier stuff, you're going to be, ahead of the game.
Okay, wow. All right. So yeah, thank you. This has been powerful and amazing also. And I'm glad I got to ask the questions I genuinely have been wanting to ask, right? So yeah, thank you. So I have these segments called the rapid fire segments, right? I would call out some things and then you pick the one you prefer. So starting now, would you prefer birth control or root cause?
Oh, definitely root cause.
Okay. All right.
No,
So
no, no question of that.
All right. So yeah, inflammation or hormones.
Inflammation or hormone? What
Yes.
do you mean? I guess I'm
Would
confused by that one.
All right. So would you prefer, inflammation in the body or the hormones in the body?
Well, you have to have both.
Mm,
Um, Chronic inflammation is a problem, but inflammation is important for healing. So when there's an infection, if something's invading the body, your body is going to, its first response is a little inflammatory response. That's the body's way of signaling healing and creating an immune response. So you have to have that. And then you also have to have hormones because that's your body's chemical messengers. That's how it tells the body what to do. So
mm,
you have to have both. You can't have, I would say one without the other. But if you're trying to
mhm.
imply chronic inflammation, then I would say definitely you want to focus more on balancing the hormones. But you got to have a little bit of inflammation because that's important to stimulate, healing and an
Okay.
immune
All
response in the body.
Okay, noted actually.
Yeah.
All right. So yeah, would you prefer quick fix or long-term healing?
I believe that they are seasons for a reason. I don't think anything in life, if it's a quick fix, is going to be long lasting. That's not how life was designed. It just isn't. One is it's not appreciation. If you plant a seed, it takes time for that seed to develop into whatever that is. The fruit, the tree, some can take, decades to grow into its, majestic height. And so nothing in life is going to be worthwhile and appreciated if it's done, quickly. And so that's why, the root cause approach, taking your time, letting the body heal itself, you're going to have long lasting results and you're going to feel so much better long term. So yeah, nothing in life to me, I don't care what it is worth it if you try to have a quick fix, a quick scheme, a quick buck. There is no such thing. There's always going to be consequences to that. So no, definitely the long term root cause approach.
Okay, well, all right. So yeah, finally, gut health or stress management.
Oh, geez. Okay. That's a tough question because they both um that's a tough one. That's a tough one. So let me give this analogy. And this is how I talk about stress with my patients all the time and why it's so important. And I think it's really dismissed. It's really people don't understand the power of stress and long-term stress. So I just tell people, imagine, a tiger got loose, in the neighborhood, or there's someone attacking you and you're running for your life. And the body, you're fairly focused on your life, right now. So the body knows this because the body has to defend itself. So the first thing that it does is going to suppress the immune system because you don't need your immune system to get out of danger immediately. It's not important. So the body will suppress that. The other system that it's going to suppress is the gastrointestinal system. And so because you're not going to be hungry, you're not going to be digesting foods, all your resources going towards running away or staying in fight, right? And so you'll see that gut disruption when you have, chronic stress. The other thing that it's going to affect is your reproductive system because we're not trying to conceive when your body is trying to fight, or run away. So stress management is so key for healing those systems. If you have gut impairment, if you have hormone issues, if you have immune problems and the fatigue, you really have to work on the stress management part. But we also know that your gut health, that impacts your hormone health. Because like I said, your hormones, some hormones are made through the gut. The levels of recirculation, reabsorption is from the gut. And so you're not going to have happy hormones if you don't have a happy gut. So your stress affects your hormones and your gut affects the hormone. So it's hard to say. I'd probably say they're equal. You can't
Okay.
have, yeah, you can't have one without the other. No, it's a tie. I can't choose one over the other because they're both so important for your health. So I have to call a draw on that one.
All right. Okay. Yeah. So this message has been, powerful, and yeah, I really do appreciate that actually. And yeah, where can listeners get to know more about you and what you do?
So you can go to my website, which is Hormone Health with Dr. Brown. Doctor is Dr. So hormonehealth with drbrown.com. And on there, the social media links are listed there. I try to put YouTube videos out every week, learning more. And yeah, we're just trying to educate, let women know that, periods pain is common, it's not normal. Even though people are trying to normalize it, it is not normal. It is a sign of inflammation and dysfunction. And so even though it's common, it's not normal.
Oh, right. Well, okay. Yeah. Thank you so much for this. And I really do appreciate. I'm happy I got to learn a whole lot, and I hope my listeners can also learn from that too. So yeah, thanks for tuning in to Conversations with Sekani. If this episode sparked something in you, make sure to share to someone who you think might need this, and also subscribe so you don't miss out on new episode. All right. Thank you, Dr.
Thank
Jeff
you.
Brown.